People, welcome back to my channel. My name is Abdul Malik. You can call me Experience One. We are also going to talk about something very important. In fact, vomiting in pregnancy, how to avoid them. Hyperemesis gravidarum. Hyperemesis gravidarum. In fact, most people get pregnant, and then what happens is that it's difficult for them to eat. And then sometimes it's difficult. They are always irritated, and then they feel uncomfortable. Why? Because there is excessive nausea and vomiting. You don't eat well. It is affecting their nutritional requirement. Let's talk about vomiting in pregnancy. Hyperemesis gravidarum. If you have not yet subscribed, please kindly subscribe, and then you share, and then you like for people to also have access to them. Now, what is hyperemesis gravidarum? It is the intractable nausea and vomiting during the first trimester that causes disturbances in nutrition and fluid and electrolyte. In fact, it affects the nutritional requirements of the mother and the fetus or the baby, or the conception, talking about the fetus. Okay, and then we say that the electrolyte imbalance, because when you vomit, you lose a lot of water, you lose a lot of fluid in the system. Because of this, okay, it really affects the mother, and shock is something that can also affect the mother severely because of dehydration. Okay, so now let's look at some of the causes of this particular vomiting in pregnancy or hyperemesis gravidarum. In fact, hormonal changes. Hormonal change is very important because progesterone is needed to maintain the pregnancy. So if during this period, okay, some people react differently because of that. And then heavy eating. If you are fond of eating heavily, okay, you are likely to be affected. Okay, you are likely to be affected. Eating heavily. Please, you have to eat little by little in order to help digestion take place, and then also in order to relieve your system for you not to vomit. And then high fatty food. Water. Drinking water whilst eating. Drinking water whilst eating is also one of the things that is very dangerous. Okay, it can lead to vomiting in pregnancy. And then sleeping immediately after meal. Please try to sit up for a while before you sleep. It's also one of the things that can lead to vomiting in pregnancy. Now, how are we going to manage? How are we going to manage this situation? We have to initiate measures to alleviate nausea and vomiting. So what are the measures that we need to initiate? It's also one of the things that we have to look at, because measure to initiate to alleviate nausea and vomiting. Here we are going to talk about anything nauseating. Okay, if you have some particular thing that is smelly, with these people, they are very sensitive to smells. So because of that, we have to look at those things. That is very much important. Okay, don't give excessive spices in the diet. Okay, it can also trigger this particular vomiting. So anything that can lead to nausea and vomiting, we have to eliminate them. And then IV fluid is very important. Why the IV fluid? Because the patient, the mother who is pregnant, okay, while vomiting, she loses a lot of fluid. So we have to try to suppress reduce the signs of shock by giving the mother a lot of fluid intake, especially when it comes to the intravenous fluid. And we have to monitor the electrolyte, monitor for electrolyte imbalance, because of when you vomit, you lose a lot of potassium. And then also, you are likely to also have alkalosis. Okay, alkalosis or metabolic alkalosis. But when you vomit a lot of acid out. Okay, now when you come to the acid-base balance, please, there is a lecture or there's a video on that. Kindly go and look at how I was able to express this, okay, for us to get a better understanding of the acid-base balance. Okay, so when you vomit potassium out, so you are likely to have hypokalemia. And then also you vomit the acid out, and then you are likely to have alkalosis. So take important notice to that. And then monitor vital signs, intake and output. Why are you monitoring the vital signs? Because the pulse rate is going to go high, the blood pressure is going to be decreased, and the patient is at risk, okay, for shock. And because of this, he at risk of shock. Then we have to try to minimize the actions of shock. So we have to make sure we monitor the vital signs. And then monitor for ketones, especially when it comes to the urine. You have to monitor for ketones. Okay, and then check fetal heart rate and growth. One of the important things in NCLEX is that anytime the mother is having a problem, okay, it affects the fetus in the uterus. So we have to try as much as possible to reduce this particular problem. Okay, so we have to check the activity of the fetus in the uterus to make sure the fetus is doing well. Because when the mother loses fluid, okay, there's going to be a decreased amount of blood, okay, supply to the fetus and oxygen supply, and then it's going to affect the fetus severely. Okay, so we have to take notice of that, and then we have to also monitor the fetal growth, okay, throughout this stage. We have to also encourage the mother to eat small meals at a time. Don't eat heavy food. Okay, small at frequent intervals. Small at a frequent interval to help one digestion, to also help what your nutritional requirements for what for the food to be properly absorbed, so that you don't vomit the heavy food out. Okay, so you eat small at a frequent interval. Encourage low fatty diet, easily digestible food, and then also um, help the mother to what? To drink water, take note, in between meals. In between meals means that from one meal to the next meal. That's what you're talking about. In between meal doesn't mean that whilst you are eating, you are drinking the water. It's very bad. Okay, it is a bad practice because it can induce vomiting. Because of this, okay, we say that drink water in between meal. So from one meal to the next meal, you have to drink water. That's the meaning of what? Drinking water in between meal. And then you have to sit upright after eating. Don't go to bed immediately after eating. It's also one of the bad practice. Please take important notice to that. And then you have to eat crackers. Crackers is very important, okay, especially when the mother wakes up in the morning. Okay, you have to encourage her to be taking crackers. It's very dry. Dry food are very important to reduce vomiting. And then also she should not eat immediately after she gets up. Okay, don't brush your teeth immediately after you get up. It's also one of the problems that can cause what? Vomiting. So you have to take a while. Okay, once you wake up or you rise up, please don't brush your teeth immediately. You have to exercise patience for a while before you brush your teeth. It's also one of the tricks that you are going to see in the NCLEX exams. So this comes to the end of hyperemesis gravidarum, or vomiting in pregnancy. It's one of the topics that we have to take note. And then take note of this in NCLEX. In prioritization questions, you are going to see the fluid and electrolyte imbalances more. Why? Because of what? The consciousness level, one of them. The blood pressure going low is one of them. And then also the loss of potassium, and the patient having alkalosis due to the vomiting. All these are part of the NCLEX exams, especially when it comes to prioritization questions. You are likely to meet a lot of them. Please, if you have not yet subscribed, kindly subscribe, and then you share, you also like our videos. And also, I will encourage you to contact us for all your NCLEX needs, okay? For all your NCLEX needs, how to solve questions, and then how to relate the content with the questions. It's very important, okay? It will help you to know more, and then to also perform well in your NCLEX exams. So contact American Dream NCLEX Prep. Have a nice day. Bye-bye.